My name is Cohan Rajan. I have been using the Waterlace for 5 years. It has really transformed the way that I practice dentistry. As you can see, I have it out all the time. I use it every day. In fact, I've used it 3 times this morning. I find it works really well, particularly for periodontal treatment. It clears the smear layer after debridement, allowing for reattachment of tissues and bone regeneration. I also use it a lot for cosmetic treatments, so I use it for crown lengthening. As you can see, I also use a syrup machine. It comes in very handy for a bit of gingival troughing instead of using Expisil or any other gum leading agents. No need for a retraction cord anymore. It's quick and easy to use. As you can see, it has a handpiece, a little bit like a dental handpiece. The advantage of it really is that it's a non-contact instrument, so there is a lot less trauma to the tissues and to hard tissues as well as soft tissues. So it allows for much more precise surgery. Also precise cutting of enamel, for example, in class 5s, where it can be used without anesthetic, and it's a very comfortable treatment for the patient. I've also found it to be an excellent practice builder. I find that patients are attracted to lasers in terms, they have an understanding of what lasers can do, and they also actively seek out practitioners who use the laser because of the benefits perceived or otherwise. But from a clinical perspective, I certainly feel that the laser allows me to practice in a better and more efficient way. Yeah, certainly the laser has changed the way that I work. My workflow now pretty much includes laser in everything except for composite restorations. And even then, when there's a little bit of gingival bleeding, if the gum health is not so great, it just integrates really well into the workflow, and my assistant is able to set it up within minutes and process it ready for the patient, for use of the patient, to enhance the treatments that I do. When I originally purchased it, I bought it primarily for restorative work as something that would attract anxious patients who don't like the sound of the drill, and patients who are looking for high-tech treatment. I'm very much about high-tech dentistry. I believe that technology allows us to do better treatments for our patients, and so the laser was an obvious step for me, and it was really a no-brainer. Having gone on lots of training in America as well as here in the UK, it just allows me to have the confidence to use the technology and use it to its best capabilities. And as with any technology, integration is a slight integration of the technology is a little bit challenging at first, but now I can't imagine working without a laser.
So once you go there, there's no going back, essentially.
Absolutely. I mean, I really cannot imagine working without the laser anymore. I think that the technology also has a real resonance with patients, and patients really appreciate the fact that I have invested in a new piece of kit that is primarily for their benefit. It has the happy outcome also of us being able to perform much better treatments for them in a much quicker way. So, for example, if we were going to do a crown lengthening to try and save a tooth which has had a fracture, which is subgingival, traditionally you'd have to carry out periodontal surgery to remove bone, and because of the nature of the way in which the Waterlace works, so it works in a soft tissue as well as hard tissue, and it's a seamless integration of the two. Once you learn the techniques, which are really not very difficult, worth learning of course, but not difficult, we find that we can carry out crown lengthenings on the same day, restore it in the same visit with the CEREC, and the healing afterwards. Because the energy of the light of the laser, it goes and stimulates the mitochondria of the underlying tissue and does tend to have very quick and painless healing. So that's another real benefit compared to traditional surgery, where you'd have to wait 4 to 6 weeks before doing the crown.